Hello. Welcome and thank you for joining today's webinar, Expert Tips to Create the Best Patient Experience with Telemedicine. This webinar is brought to you by Premier Academy 360. Attend webinars like this one or visit our content library on-demand learning at learnacademy360.com. Please chat in your questions anytime during the webinar, and our speakers will answer them during the Q&A session at the end of this presentation. We want to hear from you and continue to provide the content you want. So please stick around after the presentation concludes and answer our short survey poll. And now it is my pleasure to introduce today's speakers, Dr. Jennifer Mallinger and Leah Chatham. Dr. Mallinger graduated from Southern California College of Optometry, Marshall B. Ketchum University in 1997 and immediately opened her own private practice in Las Vegas, Nevada. She is an active member of Junior League and National Charity League. She supports the Nevada Chamber of Commerce and an organization called Community in Schools. In 2016 and again in 2019, she was awarded Best Doctor in Summerlin by her community. Dr. Mallinger is a member of the Nevada Optometric Association and the AOA. Leah Chatham is the Director of Content Marketing at Solution Reach, the leader in patient engagement solutions and innovation. She is responsible for developing educational resources to help healthcare organizations stay connected to patients throughout the care journey. Leah spent over 5 years leading engagement at a small integrated health system and has 15 years of experience developing educational content for leading patient engagement, practice management, and EHR companies. Welcome and thank you both for joining us today.
Thank you. Jamie, is there something I can I add to something? Because last night I just became a grandma for the first time. It's Dr. Mallinger. I have 7 children. My husband has 4 and I have 3. So about 10 years ago, we became the Brady Bunch. And today they range from 14 to 23. This year, one graduated from college, one from high school, and one from 8th grade. So talk about canceling a bunch of parties. But yesterday, my stepdaughter and her husband had a healthy, beautiful baby girl to add to our bunch. And the reason I wanted to add this, thank you, is because I feel like being a grandparent is so relevant because our granddaughter is Olivia. And when she was born, they sent us all these text messages and pictures. But as soon as we did Google Duo, like a synchronous live video, oh my gosh, you got to appreciate her little arms move and her lips perk and all that stuff. So thanks for letting me interject that, Jamie. And back to you, Leah.
Yeah, thank you. Hi, this is Leah. That's so exciting. Congratulations. You and I talked about how it's a whole new perspective on telemedicine, when families are having babies or having, other big momentous things. So I'm sure you'll have some additional thoughts based on being able to do that. And I don't know, Jamie, if we need to say, we've got the disclaimer slide up that we don't have nothing to disclose, I guess. So let's jump right in. So again, this is Leah. I'm going to start us off, and Dr. Mallinger and I will kind of do some back and forth here, just talking about some of these topics. But we wanted to just start quickly with just a kind of a clarification, because there's a lot of confusion about, what is the difference between telehealth, telemedicine, virtual services, what are these things and how are they different? And there are sort of officially some differences, and it is important to understand them because they do affect things like how you bill for these services. So, we'll touch on the fact that it's really important to make sure that you have set up your appointment types correctly, that everything kind of flows from that, right? And that you're billing correctly for the different services. So just very quickly, telemedicine is kind of that broad overarching term that encompasses all things, telemedicine, essentially. Telehealth is actually, when it comes to CMS and other payers, a specific type of telemedicine. It is those real-time, live engagements that you have, back and forth with someone that's video, audio. Virtual services kind of encompass everything else. So we will sort of delve into a little more about what each of these are, but we did want to just kind of clarify that telemedicine is that overarching piece. Telehealth is specifically the audio, video, real-time piece. And then virtual services is a whole list of different items that kind of fall under that. So that said, I'm going to have Dr. Mallinger just talk to you a little bit about what they've been doing and why telemedicine is so important.
Thank you. I actually think this is the outfit I might have to wear when I hold my granddaughter the first time. No, really, this is one of my favorite photos that I am seeing posted on Odie's on Facebook. It just cracked me up. With telemedicine, we don't even have to look like this, so we can be ourselves without all of that personal protective equipment barriers. And I've really found that during this time, it's stressful for patients, it's stressful for us, it's stressful for our staff. But as soon as you're doing the telehealth portion of the examination and they're live on video, my patients are so much more relaxed. And I've really gotten detailed, reliable history, almost more than when they're in person behind the mask and so scared. So I actually began doing telehealth examinations right away on March 17th when we had to close our doors for the governor of Nevada, because I still wanted to get paid while we were not seeing patients. And I was fortunate enough to be a part of the beta test for IFN-DHR's telehealth platform. It's a new one called Pocket Patient App. And of course, anytime you use something new, there's a learning curve. But I listened to a lot of webinars and Premier Academy 360s on coding and billing. Dr. Miriam Murphy did a great one. I kind of feel like I'm starting to understand this. What really solidified why I need to offer telemedicine is American Academy First Look came out on May 22nd, and they said that conjunctivitis may be the sole symptom of coronavirus. And a lot of us doctors, we kind of already knew that this was one of the first signs. But with the telehealth examinations, we're keeping our staff and our doctors and other patients less exposed, just in case these red eyes that we're used to seeing in our office all the time happen to have COVID. So I like using a HIPAA compliant form of telehealth, but because of the Centers of Medicare and Medicaid Services, the waiver 1135, we're able to use anything and still bill it as if it's a HIPAA compliant, whether it's FaceTime or Zoom or Skype, or like I did with my granddaughter, the Google Duo. I mean, we've been communicating this way anyway, so we might as well get paid. So I know there's lots of different types of telemedicine, and I've kind of addressed a few, but like, can you go over like some technical definitions? Because I found with my staff, as we wanted to post this on Facebook or put it out on Instagram or send out emails or text messages to our patients, these terms were really important for us to get correct and right, especially for billing and coding and all of that stuff too. So back to you.
Yeah. And I think it's the billing and coding piece, but also like you had on your slide, you know, you're wanting to be able to kind of connect with patients right now, and not every patient can do the same stuff, you know, and we'll touch on that a little bit in the process of kind of how you launch this in your practice, right? Is that not everybody can do audio, video, or not everybody can do, you know, use a portal, or, I mean, there's these different things. So it's good to understand what your options are, so that you can help patients understand what their options are too. So as I mentioned earlier, telehealth, as far as CMS is concerned, and therefore because, you know, CMS kind of sets the tone, most other payers as well. Telehealth is real-time synchronous audio and video. Synchronous just means real time, essentially. So it's like where you're interacting back and forth and having that communication over an audio video connection. And as Dr. Mallinger mentioned, you know, they've loosened up the regulations there, so you don't have to use HIPAA compliant technology. Although, you know, I would say if you're kind of looking to do this, implement this for the long term, things are going to change. You probably do want to be thinking about picking something that is HIPAA compliant. And right now, for a lot of visits, payers are paying the same for those real-time telehealth visits as they do for an in-person visit. That's true, too, of some telephone visits. It does depend on the visit and some other factors, but it can be, especially for patients who don't have access to another way to have an encounter. So telephone visits fall under this idea of kind of virtual services, so other things that are telemedicine. Then you have virtual check-ins. There's two different types. There is kind of a quick 5 to 10 minute phone call or text message where you're just doing like a quick back and forth to determine whether or not the patient needs to come in. Or the patient can send you like a recorded video or images, which is often referred to as store and forward, where you kind of get some stuff from the patient, look at it, and then determine whether or not they need to come in. And then an e-visit, technically, kind of according to CMS again, is this asynchronous office visit. So it's not in real time. It's a communication back and forth, but it is using a secure technology like a portal or secure email. And you're sort of having this interaction that's a back and forth interaction where you're communicating back and forth through some secure technology like a portal or email. And that is different than the virtual check-in, which is sort of a quick, short interaction to determine whether or not a visit is necessary. So just to kind of be clear about what those different types of visits are and what you can kind of offer to patients. You can get paid for all of these, but the reimbursement varies quite a bit depending on the payer and depending on a lot of other factors. But these are all options that you can offer your patients to make sure that they're getting the care that they need. And that's really, I think, the important thing, right? That you can offer them the care they need, that you can get paid something, and be able to continue to provide care during these times. So there are a number of things that are going to impact your success or your ability to use telemedicine solutions. And so it's just important to, you could go, honestly, you could probably do a webinar on almost each of these individually and talk about them in great detail, but we'll cover them kind of quickly and hopefully it's a good, point you in the right direction. So one is having really clear clinical guidelines on what you can do using telemedicine, right? Not everything is appropriate for telemedicine, as we know, and some things really are, say, emergencies where someone needs to be seen in person. Having a really well-defined workflow that can support those visits. So an example of that is, when you're doing some kind of telehealth visit, that's obviously different than someone coming into the office. So are you able to provide still like an appointment reminder? Can that appointment reminder have, information about how they access the virtual visit? Have you changed the communications you have with patients when they actually schedule the visit to support that? So you really just want to make sure that you set up kind of an end-to-end workflow that supports accurate scheduling, accurate billing, and helps to ensure that the patient can show up for the visit and you can conduct the visit and everything will flow, like it would in an in-person visit, right? Having the tools to support those types of visits, so the technology, to handle all of that, and processes to support patients. So do you know what you'll do if, a patient tries to get on and they can't get on or things like that? And what we call kind of web etiquette or, web etiquette, telehealth, telemedicine etiquette, guidance for staff and providers. So, things to make sure that there is a good experience when you're having these interactions. And really this process around supporting patients and making sure that's a good experience, and then supporting providers and staff to make sure that continues through the actual encounter is what we're sort of focusing on today. As far as that experience goes from kind of a workflow perspective, this is really starting with things like, how do you let patients know that you are offering telemedicine options? How do you let them know how to schedule an appointment? How will they complete their paperwork? How will you gather information about chief complaint, vitals, and things like that ahead of time? How will you collect payments? How will you get feedback? You probably have something in place for all of these things in terms of your face-to-face visits. But how will you do these things if you're in a virtual scenario where the patient is not coming into the office? So do you have a way for, if your staff are working from home, are the phones forwarded? Do people call for an appointment? Is there a different number? Are they able to do online scheduling? Do you have a way for them to complete paperwork on your website or through some other online means, like sending them a link or sending them electronic forms? Do you have a way for them to do electronic bill pay so that you can still collect payments the way you normally would? You need to sort of think about all those steps of the patient visit, and do you already have something in place to handle that, or do you need to make changes to be able to do that? So, and one thing to think about too is that in place to support in-person and face-to-face visits as well, because people are currently more and more nervous about things like, clipboards and touching stuff in the office and all that kind of stuff. So the more you can kind of go, the things you would do to support this virtual visit, maybe things that also help you more effectively support your face-to-face visits as well. So just be thinking about all those steps and how you can make those work.
I definitely agree with that. We actually did some cloud-based conversions prior to all of this that was happening with COVID, and I agree. It helps it so that if you are at home, you can have access to the patient's charts and you have access to the appointments, and my staff, even if they're at home too, they have access to it also.
Yeah, and what are some of the other things that you have done to kind of help sort of support the process piece around making it so that it works well for staff and patients?
I think most of us in our practices, we already have a sheet at our front desk for our staff, like listing examples of emergencies and how quickly they should get to our office. So right after we closed to comprehensive eye examinations, we sat down and we reviewed the list, and then we started a new one, one that had true emergencies that needed to be seen in the office, like my patient who accidentally put super glue in her eye instead of artificial tears. Oh. That was not a fun one. I know, ouch. But we created the list of who could come in for a telemedicine or who could not come in the office, but do a telehealth examination. Really, we started with any red eyes, like I was talking about before. And all the patients who called in with itchy or burny eyes, anything tearing, watering, any eyelid conditions, orbital swelling or subconjunctival hemorrhages. I do medication management, including all of my medication refills or anything like that. All of those fall under a telehealth platform for me. Some doctors, I've even heard that they've given their patients fluorescein strips and a blue light filter to take at home, and they do contact lens or scleral lens follow-ups or dry eye follow-ups via telehealth. I haven't tried any of that yet, but I thought that was a great suggestion. Once we started using all of this, and we have our electronic medical records, like I said, on the cloud, we have Eyefinity EPM, and we use their portal to do all of that for the charts. And then we teach the patient how to download this Pocket Patient app. It's actually relatively easy to do the exam, and I'm surprised at how clear the image is. You can zoom in and you really can see a lot. I think it is a great tool in our tool belt. The last patient I saw, she was like, "This is so awesome. I didn't have to pack up my 2 kids and bring them in their little masks. And I know you don't want any other family in there." And she was just thanking me so much. So the interesting thing is I've really found that once my staff answers the phone, talks to a patient, calms them down, because they're obviously in an emergency situation, and they tell them why they should do this telehealth examination, why they should fill out the forms on the portal. They don't have to leave their house. They don't have to wear the mask. They're not exposed to anything. They talk to them about their copays, and they tell them that we're going to bill them everything after we bill them their insurance or deal with that. And then we say, it's like FaceTiming your family or Zoom calling with your friends. And we've kind of found it's pretty easy to move on to the how do you do it? How do you download this? So what have you found, Leah?
Yeah, I think that's true. So you can kind of see some of these stats on the screen, but there's also some stats that are specific to vision, to eye care, and about 70% of people say they're totally open to doing an eye care visit over telehealth or telemedicine. And I think more, especially now when a lot of people are working from home and maybe they're using Zoom or other technology for work as well, I think people are more and more comfortable with that. And even prior to this, people were getting more and more comfortable with using WhatsApp or video calling on their phones or FaceTime for people who are, iPhone users. It really is something that I think is a lot easier for people to understand now. It's something most people have tried in some form or another, they've done video interactions with someone at some point. So we're finding too that this kind of thing is something people are more and more comfortable with. In addition to that, most of the data sort of tells us that patients have been looking for more of a digital experience overall from providers. So there's some data out there suggests, about 70% of patients also tie their patient experience or patient satisfaction to like an overall kind of customer service and digital experience with providers. They really want to have more options for those kind of interactions. So things like the ability to schedule online or fill out forms online or text back and forth with the practice to make quick changes or get answers to quick questions. Those are things they have with other types of businesses. So they're comfortable with them and they want to see more of that in healthcare. So we're definitely seeing that it's easier than you would think to kind of get people to use digital solutions because for the most part, it's something people want. And that's a good thing, I think, right now when when we want people to not come into the office and we want people to not be touching stuff and, standing around. But it is important to remember some of these things, like not all patients have access to the same tools, right? So if you're in a rural area, you may have patients who don't have access to high-speed internet at home. While it's a fairly small number of people who don't have smartphones in terms of percentages, there are obviously people out there who don't. My dad, dedicated flip phone user to his final days, he just didn't want to give it up. My mother-in-law, who's in her 80s, just only recently switched to a smartphone. So there are definitely people out there who are not quite there yet. So it is important to ask about things like internet access and can somebody do a video visit? Do they have a device that's capable of that? And you can certainly encourage people and say, we'd really like to do, this real-time video audio visit, but if that's really not an option and not possible, let's do a quick virtual check-in and see, if we can handle it quickly over the phone, or do you really need to come in? Again, this is just the kind of stuff you'll have to think about as you're setting up those clinical guidelines for, hey, what can we handle in different, types of visits and what needs to come in under what circumstances and all those kinds of things. So just important things to be aware of as you're making those transitions. And then beyond that, there are some other things that you really should confirm kind of upfront with patients. So when they're on the phone, these are things that, some of which would not have been concerns really at all prior to this, because everyone's coming in for a face-to-face visit. And if they needed to bring a care partner, or something like that, that person would just come with them. But now, whether it's a telehealth visit or not, these are things you kind of need to know up front. Frankly, most organizations are saying you should be screening care partners the same way that you screen patients. So you need to know that ahead of time. So things to ask or to explain, right? Let the patient know if they do need to download an app, how will they do that? Will you be sending them a link? What do they need to do? Again, confirming the right type of device or which types of devices they can use so they know if they can do it from their computer versus their smartphone or their tablet. If it is going to be something like a telephone call, even if it's just that quick check-in to decide if it's going to be a full visit, it's helpful to let them know what number is coming. And I know this seems kind of funny, but the fact is that now we know about 90% of people don't answer their phone. They let things go to voicemail, or they wait to see if somebody will follow up with a text message. So it's helpful to give them a heads up, like you're going to see it come from this number. It'll have our office number, the one that you have in your phone already, or whatever. You might even suggest like, hey, save this number to your phone with our practice name, so that when it pops up, they know it's you. And that's good if you're using phone as well as text. So a lot of two-way text messaging solutions today will let you use your office number. That way the patient can text you, or you can text them, and it actually shows up with your practice name on it, and they know who's texting them, whether it's a automated reminder or it's a back and forth kind of two-way text. So it doesn't hurt to say, hey, put this in your phone so you know it's us when we call you. And then make sure you have asked. Do they need to have a care partner there or a family member? Do they need to have a translator? If so, do you need to send information to those folks about how to get on if they're not actually in the same physical location? And then because things have been changing so fast because of COVID-19, this is a really good time to be verifying overall kind of communication preferences. What is the best way for us to reach you? Should we be sending you text messages or emails, or do you prefer a phone call? Largely because, you may start to reopen, and you may still have some patients doing telemedicine, some patients coming in a second wave of COVID. If where you are is hit hard and you need to quickly go through a shelter in place scenario again, you ideally want to be able to very quickly communicate out to patients, hey, we're changing these visits over to telehealth, or we're going to be following up with you with additional instructions, or we're going to be screening differently because we're in this situation. The faster you can get those communications out and the more you can use patient preferences for that, the more likely your patients will get that information and be responsive. If you're not verifying that and you're still trying to communicate, like I said, say through phone calls and patients aren't actually answering their phones, you're going to struggle to be able to quickly shift gears and know if they're how to get help if they're having a problem, or who do they call or text if they can't get on, or those kinds of things. So also just remind patients and check in and let them know, if they need to text or email a photo or a video of their insurance card. This was one of the better suggestions actually that I have heard recently in some of the things we've been doing, was someone who said a video is great because you can hold up your driver's license, you can hold up your card, you can flip them both sides and just send like a short little, 10 or 15 second video clip to the practice that has all that right there, which was kind of a cool idea. That they should just be ready to go, with all the information that they need for their visit. They should be in a quiet, private space, right? We want them to have privacy, and how they will get the instructions. So if they do need additional instructions, is that something that's going to come to them, through a text or an email, or, how will they know how to be prepared? So the more prepared you can be with that workflow and how you're going to get information to patients, the smoother this process will go, so that you don't have problems with switching people from face-to-face to telemedicine. We've worked with some organizations that have very quickly ramped up, larger organizations that have very quickly ramped up to hundreds or thousands of telehealth visits a day. And by having kind of the right process in place and the right workflow in place, I had one organization I talked to who said, we ramped back up from almost no visits one week to 1,000 visits a day the next week. And our no-show rate actually is lower than before. One, because we don't have some of the barriers that we had before, but two, we just really were good about making sure that all of these instructions and all this information went out exactly the way it needed to. So when you do it right, it can be really, really effective and successful. So etiquette. This is the sort of webetiquette stuff that's important to remember. So it is different than a face-to-face visit, right? It is not the same thing. And like Dr. Mallinger said, there's some upsides, right? You're at home and it's comfortable and you don't have to be wearing all these masks, and that's really nice. But there are some things that can affect the kind of the interaction and the experience for patients. So like having a lot of clutter behind you, or, a lot of distracting stuff that like takes the patient's attention away from you, or bad lighting that's really glaring in someone's eyes. Also sound. And I know one of the things that's been interesting for me, I've always worked from home, but most of my team members for my company work in the office. Well, now everyone's working from home. And everyone is now experiencing what I used to experience, and it's totally changed our meetings, because it used to be people would rustle and take notes and move computers and phones, and I could hardly hear half of what was happening in the meeting because there was all this noise next to the microphone where the call was going on. And I kept telling people what a problem that was, but it just never changed until now. Everyone's working from home, and everyone now is experiencing that, and it has totally stopped. So, we're not always aware of it, but it can be really distracting and very difficult for someone if there is a lot of noise near the microphone and they can't really hear you, or they're missing things. That's obviously tough. And then you want to make sure you're kind of looking at an eye level with patients when you're doing that. And so Dr. Mallinger, talk a little bit about, from your experience too, sort of what you do, for these visits to make that experience better in terms of doing that face-to-face visit.
Exactly. Before, I wasn't seeing many patients in the office, and so it wasn't very different for me. I would just see them, or I'd see them at home. But since May 1st, I have been doing comprehensive eye exams, obviously at a limited capacity. So in between, I will do a telehealth exam. And it's kind of funny because the first thing I thought was, wow, I don't have any lipstick on, and my patients are, because I'm behind a mask all day, my patients are used to me in a suit and all made up. And so it sounds so silly that you need to check yourself in a mirror, but I mean, your hair might be messed up after you take off the mask, and you might have these lines on your face from the tape because you're trying to not fog up your glasses. And it's so crazy, but it's important to address this elephant in the room. Like, oh, I'm wearing scrubs now. I've decided to wear a lab coat, or I know you've not seen me before look like this. Things have changed. And so when you come into my office the next time, these are some of the things to expect. You could just talk to them and you can have your facial expression again. So you can say, I'm sorry about the lines on my face or whatever. I just feel like it's good to address that right away at the beginning. And the funny thing is, sometimes you're sitting there as you're waiting for them to log on, and you log on, there might be a little lag. And so there's this blank screen. And I find myself going, oh my gosh, I can't believe I'm smiling at this blank screen. But I want the moment that they pop up and I'm sitting there for them to see a smiling face, because that's what they see when I walk in the exam room normally for them. Now it's going to be a little different with the mask and everything, but at least this first interactive visit, I think it's good. I'm giving them my undivided attention. I think it's important that you just speak a little bit slower than normal, because sometimes we tend to talk really fast and patients need to kind of slow down. These are new to them, the new telehealth examinations. And it's interesting what you were talking about the camera, is because I think at first during your examination, it's important, just don't even worry about anything. You just focus on the patient, look at their eyes, zoom in, take screenshots, whatever you need to do. But the moment that you're done as a doctor and you know what the diagnosis is and you know what you're going to treat them, how you're going to treat them, change your eye posture and look exactly into the camera. It's very awkward to do at first, but if you look into the camera, not at their face on your big screen, and you're giving we've done this patient education so many times. We know what we're going to say. We know how to do it. We don't have to look at their face anymore, but they on the other side feel like we're looking at them in the eye, and we have that eye to eye contact. And I really think that patients appreciate that. Leah, how do you find that patients are responding during these exams?
Yeah, I agree. I mean, I think though that it's not realistic to sort of make eye contact all the time, but if you're able to do that sort of at key moments and make so that they know you are trying to connect with them. And I mean, it really, at the end of the day, I think it's always about connecting with patients, right? So it's just trying to make sure that people know you're there and you're focused on them, and that's the most important thing. And again, people know this is new and different. So you'll find patients, I think, what I'm finding, patients have quite a bit of patience for, no pun intended, patients have a lot of patience for these changing processes, because they want to be safe and they want to take care of themselves. And if this is an option for them, I think they'd prefer to do this right now. So they'll cut you some slack at the end of the day, because this is new to everybody, Okay. So let's see. So our next piece here, actually, speaking of patients, is really kind of taking a look. There's a lot of different key performance indicators and metrics that you should probably keep an eye on, just like you would in the normal day-to-day business of your practice. And that shouldn't change just because you're doing a portion or a majority even of your visits over telemedicine during this time. But there are probably some key things to really think about when it comes to patient success metrics, just to make sure that you're kind of paying attention to how it's going and how patients are responding. One is whether or not you're seeing any new patients, potentially as a result of the fact that you're actually using telemedicine. Another one is, our patients kind of coming back and feeling comfortable doing this again, right? If they did it once, will they come back and do their follow-up visit that way? And are they sort of indicating that they're comfortable with it and it's going well for them? And then just keeping in mind, just like you would in your face-to-face and in-person practice, what is the wait time for people to get an appointment? Are you running on schedule when you're using telemedicine? How long are those visits? And then, the kinds of things you would track with some kind of follow-up, like a survey to patients, right? So overall satisfaction. If you currently use some kind of patient satisfaction survey after visits, I would say just go in and maybe modify that to support that telehealth visit. And you may need to be sending maybe an appointment-based survey where you've got one survey that goes to people who come in for a face-to-face visit and one survey that goes to people for telehealth, so that you can get a sense of how satisfied they are with the experience and any feedback that they have. Would they be willing to, say, recommend somebody to you based on their experience with the telehealth piece? And then obviously just monitoring patient retention. And these, again, are all things that you should be doing kind of in your regular face-to-face practice too. You just may want to watch this more closely when you're launching any kind of new service, but in particular now, when your practice may at times be really heavily dependent on the use of telehealth off and on for the next, however many months we see this go on. And so, Dr. Mallinger, you've gone through the process of selecting a telehealth platform.
Yes.
So talk to us a little bit about, what you think are kind of the important things. I love it. You're like, geez.
Oh, yes. When I started this process, I felt like it was back in the day when I was going from paper charts to a cloud-based system or, any electronic medical records. And I'm walking around Vision Expo East or Vision Expo West. And I'm like, I don't know which one to go with. And I'm trying them all out. And then here I am at home going, I don't know which one to go with. I don't want to try them all out. But I will tell you, in the end, as long as you have already a system in place, just do it. And it's so much easier than that process. That was a lot harder. Just find a HIPAA compliant platform. Just find one and begin to use it. And not only do you get paid more, but one day they may, we don't know, lift the 1135 waiver, and then we'll have to have a HIPAA compliant secure telehealth application. So we might as well get started using it and making it correctly done. And it's actually really nice having one that integrates with your electronic medical records and auto codes. Every system is different. So the first thing I would say is call your electronic medical records system company and just ask them, say, are you working on a telehealth platform? Do you have one that integrates with our system? Why learn something new if you already have it and you're working with it? And I really found that a lot of them are coming out with either free ones right now or a free trial period. I mean, the list goes on and on. I feel like every day a new one is popping up. Eye Care Live and 2020 Now and Digital Optometrics, Teledoc, Doxy.me. I mean, Pocket Patient app. There's so many. Eye Exam Virtual, Eye Matrix, Modernizing of Docs. Like, it's a lot. But if there's one that can integrate, just that makes it a lot smoother. And then you get to decide as a doctor, how much of a comprehensive eye exam do you want to do via telehealth? Is it important for you to do visual acuities, or do you want to just ask your patient to cover one eye and cover the other eye, and how is their vision like that? Or do you want to have on your website a Snellen chart, and you can direct them to the website or email them that, have them printed out, put it 10 feet away? How far do you want to go with your telehealth platform? Really, as you make those decisions of what's important to you. Do you want to have all of the consent and have all the proper documentation? Did this platform already create it? And then you don't have to recreate this statement and put it in the chart. You can just have it directly go into the chart. But I would say one of the big things that's so important is follow up. After we do our examination, we really need to follow up. I've seen a lot of situations where doctors have done a telehealth examination and maybe something didn't properly go, whatever, and then the patient ends up in a different doctor's exam room and there happens to be a foreign body in their eye or whatever, where you have to take it out in an actual exam room. And if you follow up the next day and the patient says, my eye's still really a lot of pain, you're face-to-face, so you're talking to them via the telehealth. They can see your eyes, you can see their eyes, it's still red. Then you can convince them it's really important to come into the office and everything. I will say that billing has really been the most challenging part for me and my staff. And so if you can find a telehealth platform that integrates or auto codes or do a lot more webinars on coding and everything. That's really nice to have that integration done. So I actually have some exciting news to share today. Speaking of all of this telehealth, VSP has decided to extend their coverage all the way to the end of June for primary VSP vision care. They've extended their access to VSP primary eye care plan services through the end of June to members and their dependents, even if they currently don't have coverage with this benefit. It's not all of the VSP members who are covered, but most of them, all the ones who either their regular VSP member, their dependents, MetLife, Cigna. It doesn't include the access plans or the vision savings plans, but that's really nice to know that we're going to get paid if their medical insurance doesn't cover it. We have this extended one. And if you have questions, you can, VSP has a phone number. I'm sure most people know it. It's 1-800-615-1883. And you can call them if you pop up with a patient and it says that they don't have this primary eye care plan. You call them and they give you an authorization and then you can bill it. So I would just say my last bit of advice is just do it and bill for it and educate yourself and pick a platform and just schedule your first patient. It might be a little bit uncomfortable at first, I'm going to be honest. But once you explain to your patients why, we're going to do it this way. And then if in the middle of your exam, like I was saying before, if you're uncomfortable at all with the way that their eye looks, then you can say to them, I really need you to do an in-person visit. And these are all the precautions that I've been doing at my office. I've been taking temperatures, or we've been wearing gloves, or we have masks. Like we have all this protective equipment at our office to protect you as a patient. And then they feel more comfortable and confident coming into your practice because you've prepared for them to do this in-office visit if the telehealth examination doesn't go the way that we wanted it to go. So, Leah, do you have any last-minute takeaways?
Well, yeah, I think, so we'll just go to the key takeaways here, and I'll bring it back to this idea, this communication thing, like you're saying. I think if you just jump in, just prepare the best you can, right? Prepare. Try to think about the stuff. You just do the best you can to kind of figure out what's this going to look like, and we're just going to jump in and do it, and make it happen. And then with your patients, just communicate. Let them know this is what we're doing. This is how you access these services. This is how we're going to communicate with you. We're doing this for your safety. We're doing this to make sure you get the care you need. It's just letting them know. It's the same thing with the like Dr. Mallinger is saying about when somebody does need to come in for a face-to-face visit, the best way to put them at ease again is just communicate. Here's what we're doing. We've encouraged a lot of practices to use some kind of virtual kind of waiting room scenario where people stay in their car and they text you when they arrive, and then you text them back to say you can come in, or you text them back and say someone's going to come out and collect your details and take your temperature. And, you let patients know up front, we are going to check your temperature. You are going to probably have to wear a mask. This is how the processes work. It's really just all about communicating with people and letting them know what to expect. And as long as you're doing your best to kind of prepare yourself and your staff, communicate with your patients, and then it's just practice. It's, maybe you practice it a few times just with you and your staff, and then you just start doing it for time, and the more comfortable you all will get with it. And at the end of the day, that's the best you can do. And you just kind of have to make your best effort to set things up as best you can and prepare yourself and your staff and your patients the best you can. And then you just sort of go for it. It's like Dr. Mallinger saying, hey, you just got to just do it. And I think what we're seeing from a lot of the experts is that this is probably going to go on off and on for quite a while. And it will be up and down in different areas. We'll see different things. Some may do okay, and some areas that haven't been hit very hard may suddenly see, an increase in cases. This is a very unpredictable thing that could go on, off and on for quite a while. So the more you can do to kind of get yourself ready for whatever may happen, so that you just are ready and you can make these changes quickly, or you can offer these services quickly to patients, and get your staff and yourself and your patients comfortable, that's your best approach, I think. And so we've got some resources here, which we wanted to mention that I think, like Dr. Mallinger was talking about with these issues around billing, which is the biggest challenge, I think, for a lot of people. There have been some really great resources and webinars, podcasts. There's the LearnAcademy360.com. And of course, the AOA has been putting out a lot of really good information. And I believe you guys will get these links and the slides, so you'll have these. But these are great resources for kind of helping with making sure that you can get the information you need to accurately bill and kind of do all that stuff too. All right, so I am going to hand it back to Jamie. I think she's going to facilitate questions for us. Hopefully you guys have been adding in questions as we've been going along.
Yes, great. Thank you, Leah and Dr. Mallinger. That was a lot of really great information, and I love that little raccoon mascot that you had on there. He was so cute. So we're now going to move into our Q&A segment. And so as a reminder, please feel free to submit your questions using the chat feature for our wonderful speakers to answer. But we'll go ahead and kick it off with our first question, which is, how do you code a red eye?
Oh, I think, Dr. Mallinger, do you have feedback on that?
Oh, that's a great question. And can you go back to the last slide, Leah?
Yeah.
Because I'd really like to reference back here. Like I was saying before, a lot of the coding questions can be answered. American Optometric Association has done a great job with all of these coding webinars. And most of it depends on if you've prescribed medications or not and all the different ones. So I would reference back to them. And then VSP also has a great telemedicine resource guide that talks about VSP billing codes versus Medicare and non-VSP billing codes, and going to them and getting educated with the different CPT codes. And now we're able to bill for evaluation and management codes that we weren't able to do before, like 99213s with a 95 modifier and stuff like that. So getting reacquainted with all of the codes, whether it's a virtual check-in or an online digital evaluation code, I think that's really important.
Yeah, and I'll say we have some of those links too. We've put up some blog posts and some resources at solutionreach.com/resources too that link you back to some of the key places that the AOA has information listed about billing information and things like that as well. So there's several blog posts on the blog, and then there is a telehealth guide on there that has really detailed information with links for multiple specialties. So I think the best thing is to really look for information that's coming out from CMS and AOA and use that to guide your billing processes. One thing I will say, Elizabeth Woodcock, who has done some education for us recently and is a really well-respected expert on billing and coding, one of her key recommendations was to take the time to create a spreadsheet for yourself with all your payers on it. It really is important to go to each of your payers and ask them if there's anything specific you need to know about billing for telehealth for that payer, and keep a little spreadsheet that gives you any additional guidance that your staff can reference back to. So if there are certain modifiers or other details that you need, you'll have those. And then her other sort of suggestion was make sure you're really, really documenting absolutely everything, every interaction and conversation you have with your payers, as well as your visits, to make sure that you're covering yourself for billing, since everything is so new and different right now.
Great, thank you. All right, our next question is, what if the patient does not have a printer hooked up to whatever they are viewing on?
I'm guessing that's like Dr. Mallinger was saying, to print out, say, so that you can do your screening and stuff. Do we think that's what that means?
I would guess, yes.
Probably.
Or do they need
I have done telehealth examinations without using a printer, without taking visual acuities. If that is a problem and doctors want to have the visual acuities documented, then maybe they can work with a family member that has a printer, or a caregiver or someone that can help them But I wouldn't use that as a roadblock to at least getting them the care that they need and the help that they need. You can still do the full telehealth examination without the visual acuities if they don't have it.
Okay, thank you. All right, the next question is, do desktop cameras work as well as iPad cameras? And do you have any recommendations on methods of ways to different things to use or different cameras that you found work best?
Yeah, I can take that one. For the most part, these days, most devices, the most computer cameras, phone cameras, and tablet cameras should be fine. From talking to some different folks who are sort of more experts in telemedicine and have been doing this for a long time, several of them said if you're going to buy a new camera, their preference is Logitech. They do think that those tend to be kind of the better cameras. You might find some things are back ordered right now, but that if you're thinking you're going to purchase a new camera, then that might be the way to go. And obviously that doesn't get into, there's a whole portion of this that can be more about different types of telehealth solutions for certain specialties or, doing like DICOM images and things like that. And we're not getting into any of that. This is just really from my perspective, kind of for your basic telehealth visits. Most of the technology, if it's fairly recent, should be okay. But Logitech would be a good option otherwise.
And I really found even using their phone, I'm able to get very good images of their eye and what's going on and look at their facial expressions and see around their eyelid and orbit and everything.
Yeah, and I think it's particularly impressive. Like some of the newer phones and newer cameras are really, really pretty good quality.
Great. Thank you both. All right. What do you do if you have a Scribe?
I can take that one, Leah. That's a good question. I'm in my office now. And so if you are back in your office, you can just have your Scribe sit next to you as you're doing your examination and they can enter in everything for you. That's actually really nice because then you're just talking to the patient. You're not entering everything in and talking them back and forth. Some telehealth platforms have an extra link where your Scribe can log in and be on it with you. So that would be another great question when you go through interviewing these different or calling these different companies and asking them about their telehealth platforms, which one to go with. Because if that's important to you and you have a Scribe and you want them, maybe they're remote and you want them to start working and you're at your home and they're at their home still, but you want to be able to do these examinations and bill for them and everything. That's a good question and another important thing to add to your list of this is important to me because I have a Scribe as you're finding which platform to use.
Yeah, and I would just add to that that's kind of the same thing as talking about things like care partners or language interpreters or any of those kinds of things. You want to make sure you've got a solution that's going to support not just the provider and the patient, but whatever other third person or fourth person might need to be on there. And that it's not going to be difficult, that they've got an easy way for you to be able to have whoever needs to be on there.
All right. Next question. How do you decide if a patient should come into the office or not?
Yeah, I kind of addressed that a little bit already with putting together a sheet and being very specific with your words for your staff of what's important for them to come into the office or out of the office. I've seen some offices do like a workflow diagram that maps out when you should come into the office, when you need to be seen, or when you can do any form of a telemedicine examination. I think that's really important to have an office meeting and talk to your staff about and be very clear because they are the ones who are going to get a new patient. During COVID times when a lot of the offices were closed, someone would call very panicking, talking to my staff. And so we had to just really, like I said before, calm them down and say, this is a true emergency. This is something that Dr. Mallinger is going to have to see you in the office for. These are the precautions we're going to make. Or this is something that Dr. Mallinger can see you through our new telehealth platform. We're going to download now, all those other things that we've talked about before. So it's important for the doctor to communicate to the staff which patients should come in the office or not. So I think that's important to review with them.
The one thing I would say is that maybe, we talked a little bit about sort of establishing some basic clinical guidelines for how you use telehealth. It may be different right now during COVID-19 than it would be normally, right? So you may have two sets of guidelines. You might have one that's your COVID-19, way more people can be seen over telehealth set of guidelines, and then your not COVID-19, what normally would qualify kind of thing, and switch between the two depending on what's going on, and especially if you're thinking that you're going to make telemedicine something you're going to integrate into your practice for the long term.
That's a great point. And that actually segues really well. We have time for just one more question. And this question was, how long did it take your staff to feel comfortable with all of these changes?
That's great. No, my staff is amazing. They've really come a long way with me through this. It actually does not take many patients. I would say after the first 5 patients or so, they were a lot more comfortable with it. But I, at the very, very beginning, had each of them pretend like they were a patient. So they knew what it was like, how much trouble it was to download, or how easy it was. And each of them had a different experience. And so that was simple practice for me. And then I think once they did it themselves and they were a patient, they were like, oh, this is pretty easy. I like it. But it definitely takes a few patients to go through and before you get comfortable with that.
That makes sense. Okay, well, thank you, everyone. This concludes our time for questions. I'd like to take a moment to thank Leah and Dr. Mallinger for their time and insights today and a very informative presentation. We really appreciate you both being here. Now, for those of you on the call, you should see a survey window on your screen. Please take a moment to provide your feedback. As a reminder, we will be sending out any email with the recording of this webinar and any handouts within the next 24 hours. To register for more webinars like this one, view recordings of previous webinars, listen to podcasts, and more, be sure to check out learnacademy360.com. Thank you for joining us today. Have a great afternoon.